that your body, that what you have is your gift, and that it's not a dress rehearsal, right? We really only do get one shot with our body. And so a lot of the things that we try to do at our practice is prevent injuries, prevent problems. That's one of the ways that we try to go into the community, particularly with the young children, teaching them proper mechanics when they're going to participate in sports and try to prevent them from having injuries, because accidents are going to happen. They just are, and I'll always be busy. I'll always have a job, but if I can prevent something, then I'm a lot happier with that. So that's part of the reason why we're here today. As was said previously, I'm Amanda Martin. I grew up in Oklahoma. I grew up in Tulsa, Oklahoma, and I did my education at the University of Arizona and then went to medical school in Oklahoma. And then I moved to New Jersey, which was an experience for me, having grown up in the Midwest and the South, and did training in New Jersey, and followed by a fellowship in sports medicine here with Dr. Lemak. After I finished that, I said, I really enjoy the sports part, but I feel like there's something else that I really want to do as part of my practice and part of my service. And so I was invited to come to South Africa and participate in a trauma fellowship at Groote, which is, if any of you know, it's the first hospital where a heart transplant was done. So it's a really, really neat academic hospital, but you also got to participate in a different kind of healthcare system where perhaps not everyone in their population is as lucky as we are and have all of the opportunities that we have, and you see things that are very difficult injuries. Now, I got to go down into a mine. A mine had collapsed, and I actually got to perform an amputation in order to remove someone from a mine, which was certainly an experience in itself. I saw a number of people who had an accident where they were siphoning gas from a main line in their shanty town so that they could have heat in the winter, and there was an explosion. And so there were a number of injuries from that. There's things that we don't always encounter or see in our day-to-day life. And so that was really a positive experience, but also it made me feel very, very, very blessed to be practicing in the country where I am, where we have all of the tools that we have to lead very healthy, happy, productive lives. And so having said that, now I'm going to tell you that nobody in this room has an excuse to not do the strength, the balance, the walking, the exercises, because we have the opportunity to. And sometimes we put ourselves at the bottom of the list of things that we have to do, when really we shouldn't. That we should find time for ourselves every day, because that is the least selfish thing you can do, because it keeps you healthy and around longer for your family. So that part being said, we'll get started. So one of the things that is very common, and I am going to do it, I'm going to make everybody raise their hand. Has anyone in this room had a hip fracture? Just one? Two. Oh, two. Okay, so two people have had a hip fracture. Who in this room knows somebody who's had a hip fracture or is related to somebody? Right. So just about all of us, right? It's unfortunately a very, very common injury, and that's one of the things that oftentimes can be prevented. Not always, but it can be prevented. So we're going to talk about that. So one of the things that we first talk about is how to protect your bones. Now, when you're young, and I want everybody here who has a young person in their family or who knows a teenage girl to go home and tell her she needs to be on vitamins, because we build our bones up until about the age of 30. That's when we're making our bones as strong as they are. So you avoid things like soda pop, smoking, all of the bad things for you. They're bad for the kids, and they shouldn't be doing it, because that's when they're getting their stronger bones. Once you reach the age of 30, it's about keeping what you got. So we want calcium and vitamin D. If you have a test, if anyone here, I'm sure many have had a DEXA bone scan that tells you about the density of your bones. If your bones are less dense, then we recommend medications. We want you to do that. I'm sure it goes without saying, we never want anyone to smoke. Smoking actually does make your bones more weak, so we're really cautious about that. And the other thing that people often don't think about is the number of medications that you're on. So certain medications can put you at risk for not only having problems with your bones, but also the combination of those medicines can put you at risk for getting dizzy, increase your risk for falling. They can be sedating, so you get confused more easily or fall. And oftentimes it's not one medicine, but more the combination of your medicines. So one of the first things I ask people when they come see me is, do you have a primary care doctor? Because if you see a number of specialists, if you see your heart doctor or your doctor for diabetes, you want all of your medicines to always be going to your primary care doctor so that they can catch if there's any medications that can interact, because they can certainly put you at risk for health problems and also put you at risk for falling. So we want you to have one person that's managing that. And if you can, to also use one pharmacy, because the pharmacist is another check in that balance system. So if they see, with your list of medications, so with computers, if anything could possibly interact, a way to avoid that. Perhaps there's different medicines or one that you don't need anymore. So we want to be careful of getting those medications. Does anybody keep a list in their handbag? I hope everybody says yes. Good. So that maybe we can make that list a little bit shorter, because sometimes we can. So if we look at your normal hip, I'll show you here. This is your pelvis, and this is your femur. It comes up and forms your femoral head, and this is the socket. So it's a ball and socket type joint. A normal healthy hip doesn't have any arthritis, works really nicely. A hip fracture can happen in a number of different places, and this is sometimes where confusion comes in for people. So if we look at a hip, you can have a break right here, and that's called a femoral neck fracture. That's the one when people they say they had half of a hip replacement or a hip replacement. That's the fracture that gets you that, because you lose the blood supply to the bone, and so you can't really fix it because it would kind of turn to mush and fall apart. Sometimes people get breaks more down in here, and those are the kind of fractures that we can fix. Those are the kind that sometimes it sounds gross, but we put a nail inside the bone and it's protected. So who is at risk? This is for hip fractures. Anybody over 65. So we won't do a hand raise, but that's a number of us in the room, right? Anybody over 65. And unfortunately, women, we're still 2 to 3 times more likely to break our hip. It's not fair, but it's true. People with a family history of fractures, because we know that bone disease or brittle bones can be a genetic thing, and it can be common in families. So if you have a family history, anyone with poor nutritional intake is at risk. So very thin people who maybe aren't getting all of their vitamins and nutrients are highly at risk. And then people who have arthritis, anyone who has confusion, and those who take certain medications. People who are at risk that maybe don't realize it are people who have seizure disorder because of the medications they take. Anybody with problems with their kidneys is at risk because your kidneys participate in turning over your bone and making strong bones. So there's a number of us in this room who probably could list one condition at least that would put you at risk for a fracture. And this is what osteoporosis is. This is a schematic. So over here we have, I will learn how to work this, I'm sorry. Over here we have healthy bone. It's sort of like sponge on the inside. And it's got all little areas of holes and then this is like a meshwork. If you think of it as a scaffolding, that's what good healthy bone looks like. With osteoporosis, the problem is that you're taking out more calcium from the bone than you're putting in. And so you're taking it for other things. We need calcium in our body for eyes, our heart, everything else. And the bone is the one that suffers.
Yeah, just good.
Okay. The bone is the one that actually suffers, because in your body, no matter what, the heart and the brain outweigh bone. So we're kind of, orthopedics are down low on the list. That happens in the hospital too. They say we're the carpenters. So, when the real doctors, the medicine doctors say everything's okay, then they let us see a patient. And that's kind of the way that it works in your body. So with osteoporosis, your body's taking out the calcium for other things and you're not putting it in, so your bone's getting more and more weak, and this is exactly what's happening. So common symptoms of hip problems or arthritis that you may already have are difficulty when you put weight on your hip. That's a common one. Pain and stiffness in the morning is a really common thing with arthritis. You kind of wake up and it's stiff and it's difficult to move, and then you get up and get going and you're kind of okay again, and then the more you go, the worse it gets again. Because you're not comfortable when you sit either. With knee arthritis, you're kind of okay if you can sit and rest, but when your hip hurts, sitting is just as painful. People say they have trouble putting on their shoes and socks. So we tell them, to really work on that motion. People will get weakness in your leg muscles, but also in your core muscles. So your abdominal muscles, your bottom muscles, your back muscles, all of those things can add up. And if you're having those problems, then you're even more at risk for a fall and more at risk for a hip fracture. So if you were to have a fall and have a hip fracture, I'm sure we can ask you, right? The first thing, you can't get up, correct?
Are you sure?
No way. So that as soon as you fall, you lose that ability, because your stomach muscles, your bottom muscles, your back muscles, all actually attach to your hip bones. So when that bone breaks, nothing's going to work. So there will be no question if you've broken your hip. So we have all sorts of different treatment options for how we fix it. And we talked about if it's just a little crack, sometimes we can put some screws across it. If it's a breakdown here, like we talked about with the nail, this is what that nail looks like. And probably nobody in this room but me thinks this is cool, but I think this is very cool. This is a very small incision, and the nail actually goes inside your bone. So we saw that picture of the bone where it really wasn't very thick with good bone in it. This nail sort of takes place of that, and you could keep it forever. It goes all the way down to your knee bone, protects you if you were to fall again. So that's a pretty neat one. For people who break and have, the break that moves up high on the neck, they can get a hip replacement or half a hip replacement. The great thing about it is a hip fracture used to be a really, really, really big problem. You're going to be laying in bed, at risk for bed sores, pneumonia, those sorts of problems. Now, with this kind of technology, we can get you up and let you walk on it the very next day after surgery. So that solves a lot of the problems that come along with that kind of injury because we're able to get up and get moving. Again, we're hoping that nobody in this room has to deal with this. You know, we want to prevent it. But if it does, the good news is that we're getting a little bit better at it. So that's great news for anyone here. And the rehab is very extensive. I'm sure we can ask a question of how long it took until you were feeling better.
Well, you see, I had rehab for 14 days.
Right.
And then I started outside therapy. 2 to 3 months.
Yeah, I would say that's about right. 2 to 3 months. It's a big deal. The force it takes to break a bone also affects all of the muscles in your body. And then the surgery, unfortunately, it's surgery, we cut, so that makes the muscles weak. So the things that we work on in rehab are the things we should really be working on before it ever happens. Because with rehab, what we're trying to do is strengthen your muscles, do conditioning exercises, help you with your balance and coordination. And we progress with your normal activities of daily living. And a lot of people go to a rehab facility, and when they get past that, then do it on an outpatient basis. Well, when you look at this stuff, this is all the stuff that we could definitely do without having to go through a 3-day hospital stay and a big surgery and that kind of trauma to our body. So this is what we talk to people about doing beforehand. So anyone who does have an option to do a strength and conditioning class, I would highly recommend it because that's going to help you hopefully avoid this problem having ever had it. The majority of people who break their hip, believe it or not, it's a trip and fall. Some people break because they get dizzy and fall, but most of the time it's what we call a mechanical fall. I tripped on the throw rug in my kitchen. I got up in the middle of the night to go to the restroom and I tripped on the bathroom rug and fell. That's the most common thing that I hear from people. So there's a theme coming. I'm sure you'll pick it up in a second. And we want to avoid those things that can jump out and grab us in the middle of the night. So we'll move on to wrist fractures, and then I want to talk to everybody about the strategies. How do we keep this from happening? So a wrist fracture. The number one thing on it that we always say is do not put yourself at risk, okay? We're going to come back to that. So there are things that are common sense that you're going to do, you're going to fall. There are things that people do that put themselves at extreme risk for these kinds of things, where you hear the story and you say, yeah, of course you fell. So again, it's the same stuff we talked about for the hip, a good diet. I can't emphasize that enough. Taking the time to eat a healthy diet with the dark, colorful, leafy vegetables and getting calcium and vitamin D. We want you to build strong muscles to prevent the fall in the first place. We want you, if you're going to do silly things like rollerblade, I don't know if that applies to anybody in the room, but if it does, if you're going to rollerblade, I'm not telling you not to, if you're going to do that or get on maybe a grandchild's skateboard or something, you need to wear the proper pads, which includes a helmet, because it's a bummer to break your wrist. It's a real bummer to hit your head. So again, the brain still outweighs the bones. Calcium supplements, if there is particularly for women who are postmenopause or over the age of 35, calcium should be a supplement that you add to your other medications. And if your doctor hasn't recommended, see me after and I'll recommend the dose for you. And that's a really, really important one. The other thing we want you doing is weight-bearing exercise. So swimming is a wonderful thing to do for your heart, but we want you walking. We want you doing some minor weights. And it doesn't have to be anything big. Believe it or not, canned vegetables make a great upper body workout because it gives you a little bit of weight and resistance, and that actually builds your bone, having the weight-bearing force for it. We want you wearing good shoes. If you're exercising or out doing things, we don't want you wearing sandals. We want you wearing tennis shoes, or a good solid flat shoe that gives you a lot of support. Shoes are another big thing that people trip on, particularly like flip-flops or something. They get that bottom caught and people trip over that. So flip-flops, and I'm guilty probably more than anybody here about wearing flip-flops, but they do put you at risk for a fall. If you're already starting to have trouble with balance or strength, there is absolutely no shame, and I would encourage anyone to do it, to put grab bars in your restroom at home. We think about using it in public places, but we don't really think about that at our home. But that's a good thing to do. A bar in your shower is a good thing to do because your shower is wet. It puts you at risk for falling. So if you have something that you can help support yourself with, that's a good preventive thing. And then we, very, very common sense. We're lucky because of where we live. We're very blessed to live in Birmingham. We had a great winter this year. After 5 winters in New Jersey, I felt particularly blessed. When it snows or there's a little bit of ice, and we know it only lasts a day or two, that is not the time to go walk your dog on an extensive walk. that is when you slip and fall and break stuff. But, I mean, really, really, truly. I used to get tickled in New Jersey because if I was on call and it was raining, I knew it was going to be a quiet night and I could probably sleep because the Northerners don't go outside in the rain. But if it snows or ices, everybody, the first thing they do, everybody's off work, so they all go outside and, shovel the driveway, walk the dog, all those things, and everybody breaks their hip, ankle, wrist. It's an extremely common thing. I never really understood it, but it's definitely a pattern. This is your normal wrist. This is what it looks like when you're about 15. So your finger bones are here. And then this is your radius, which is that bigger bone by your wrist, by your thumb. And then your ulna is that little skinny bone over to the side. And then you have all 8 of your carpal bones inside here. When people break their wrist, more often than not, they're breaking these 2 bones on the end right here. That's your radius and ulna. And we put some pictures on here. And again, like anything, everybody gives orthopedic surgeons a hard time and says that we just like to fix stuff. But we do think about what we're doing. So if you have a fracture down here, this is sometimes a really nice one for a cast because it doesn't go into your joint line. But once you start getting these fractures in lots of pieces, then those become a little bit more complicated and a bigger deal for you. And believe it or not, the softer and more osteoporotic your bones are, the more likely you're to have a fracture with all of these pieces. So the good bones sometimes will get this, the bad bone get this. So that's one reason we try to talk to you about getting your bones as strong as possible. And again, risk factors are all the things we know. Unfortunately, it's being elderly, being someone who falls frequently, and then also it's people who have an active lifestyle. Bicyclists put themselves at risk for falls. Any postmenopausal female, anyone with bone cysts or a bone tumor, any history of cancer can later put you at risk for bone disease, not only because of the treatment that you had, but also sometimes the cancer can metastasize to bone and you won't have any symptoms other than breaking something. And then diabetes and osteoporosis are the big ones. So if you break your wrist, we put this slide in here, but you will know because it will hurt, it will be crooked, it will be tender, it will swell, and it will bruise. Has anyone broken their wrist in the room? So I'm telling the truth, right? It's swollen and it bruises up instantly, and you know. So the treatment options have to do with what kind of bone you have. Some people get a cast, and I love this cast because it's all flowery, and that's all they need, which is a great situation because you get to stay away from surgeons, which is what you want. Some people actually will put a little frame, and I like to say this is like Legos. I love doing this, but people don't really like it because it's a frame that's inside your bone but outside your body. So people think it's a little weird. But sometimes it's a great thing to do if you had a bad scrape or a bad problem or your bone had come through the skin and we want to leave your skin alone so it can heal. This can be a wonderful thing. If you have one of those kind of smashed wrists, and the skin's okay, sometimes we'll put a plain screws in there, and that's great because this can just stay. So there's all sorts of different options, and one is truly not better than the other. So sometimes people will say, well, this doctor wanted to do this, or this doctor did this for me. And the truth is probably that your break was different, because how many times have you dropped a dish and they all break the exact same way? They don't, and your bones don't break the same way. So your doctor's, going to think about what the best treatment for you is. And again, you're held still for a while, and then we have to get all of your range of motion and your activities back. So little things. I'm sorry, what was your name?
Juanita.
Miss Juanita. When you were first getting your motion back in your wrist after you had broken it, little things were hard, correct? Like holding a glass of water or sweeping or things like that. So a lot of the therapy is just about day-to-day life, combing your hair, shampooing your hair, things that you don't think about. We try to get that motion back. So again, it sounds, kind of difficult, which is why we want you to not have to deal with it. So prevention is key. And this is the only thing anybody in this room hears today. This is truly the only thing I want you to hear. There are things that you can do in your life to keep these things from happening. So everybody should sign up for the strength and conditioning class. I'm going to say that first. Stretching is unbelievably important for your brain and your muscles in order to help you with balance. So something as simple as walking and stretching will automatically help improve your balance and your coordination. So that's something anybody can do, because a lot of times people will say, well, I can't do the strengthening because my back hurts or I have arthritis in my knees. There is something that everyone in this room can do that will help them. If that means avoiding the painful area, there's still something every single person in this room can do to help. And stretching and walking are two of the best ones that you can do, because walking is weight bearing and stretching activates your core muscles and all of your other muscles, and it helps you to have your balance. It just, your muscles train themselves, much like, you can blindfold some of those basketball players and they're going to make the free throw every time because their muscles remember what to do. So by stretching them, you keep your muscles very active, and they remember what to do if you lose your balance, and you prevent yourself from falling. So these cartoons exist for a reason, because these are things that people commonly do. Who here has stood on a chair to change a light bulb? That will admit it. Yeah, me too. That is a terrible idea. It's a horrible idea. You sit in the dark, light a candle, get somebody to come change your light bulb for you, because it is terribly common, and it's such a bad idea. Now this one, I believe this cartoon was made for my mother, because my mother is famous for this kind of stuff. She will stack a little step ladder on top of a table in order to do something. I can remember when I was young, she actually was hanging curtains. My mother is a sort of a to-do person. She does a lot of projects. And she was hanging curtains over our sink in the kitchen, but she was standing in the sink, which was wet. And then she turned and hopped off the sink, and her feet slid out, and she had 2 spine fractures. And it's not funny, it's terrible, but that's exactly the kind of stuff my mom does, and she has not learned. So I have a rule in our house, and this applies to everyone. Nobody uses a ladder alone. I mean, that makes sense, right? But we all do it. I mean, why would you climb up on a surface that's wobbly without at least somebody present? Now, my mother just visited me 2 weeks ago, and she painted a bedroom upstairs and used a ladder alone. So if I can't get her under control, I want you all to give her trouble when she comes to visit, because you'll get to see her some. And the other really common thing, and we all love them because they look so nice, are throw rugs. Throw rugs are a disaster. I bet just about everybody here has a throw rug in their house or their apartment. And I'm not getting down so much on the ones maybe in the living room that your furniture is on, but those little rugs in the kitchen and those little rugs in front of the toilet or the shower in your bathroom are death traps. They are absolute death traps, particularly the bathroom ones. Well, really the kitchen too, because most of the time when somebody breaks their hip, they say, I got up in the middle of the night, it was dark, didn't turn on the lights, right? Everybody does this. And I wanted to go to the kitchen to get a glass of water. You trip on the rug, you don't see something, and you fall. So that's a really, I guess maybe turn on the lights if you won't get rid of your rug. Because I know there's people in here right now saying, yeah, well, that's not going to happen to me. I promise you, there's no rugs in my house because I'm afraid of it. I've heard it enough. And the other one is the bathroom. You have the throw rug in the bathroom, and then you get up in the middle of the night, it's dark, you're just going to go to the restroom, you don't want to get awake because you want to go back to sleep, and you trip and fall. Those are extremely, extremely common. I bet I hear it at least once a week from somebody. That's the most common thing that happens. Another one, speaking of the chair, I had a really sweet lady. She's real young. She's only, I want to say, like 51 or 52, around Christmas time this year. She was decorating her Christmas tree, and she sort of had a genius system. I see where her head was, but it did not work out for her. She fell and broke her wrist and her elbow. What she had done is put up a series of chairs around her tree, and she was putting the lights on. And she put a series of chairs so that she didn't have to get down and get back up constantly. So she was walking in a circle around her Christmas tree, and of course lost balance, fell, broke her wrist. And she's a professional musician, so that was, not great for her. But she did great. It's just, it was avoidable. So things that are avoidable are the things that we want you to really protect yourself from. So, I'm not saying not to rollerblade or skateboard. You can do it. You should wear the proper equipment, and please wear a helmet. Bicycling is a great activity. Walking is a great activity. But just common sense things to prevent. And if I can convince one person here to get rid of their throw rug or to not change light bulbs on chairs, then this is a success.
But you could use a step.
You can use a step ladder, absolutely. Absolutely. But again, I would tell you to use it cautiously. And please don't put the step ladder on top of anything or a phone book on the top step of the step ladder. These are all things that people have said, so that's why I mention them. You just, a low step ladder is perfectly safe. You just have to be very smart, because people, even with the step ladders, you step off backwards, you lose your balance just a little bit, and then you take what would be a fall from standing height, just standing here, that could possibly break your wrist, and add 2 feet to it. So then you go from having maybe a small fall to having a big injury. And those are the common things. Most of the young guys, the workers who build our house, who do our gutters, who do our roofs, when they fall, it's devastating because they're falling from a roof height. And they have perfect bone. They're in perfect shape. They're strong. It's just, nobody is going to have a good outcome from falling from that height. And so that's why we caution you with the step ladders and the chairs and climbing on top of things, is that it's just adding another 3 feet to your fall. Hopefully there's a neighbor or somebody who's kind enough who will come help you with that stuff. And I don't change light bulbs in my house. I'll let them be burned out for a month. I don't care. I'm not going to do it because I wouldn't be able to operate, so I'm very particular about that.